A blank is any mark on the skin that may indicate an injury or damage that changes the structure of tissues or organs. Lesion. A blank is a lesion that is a different color than the color of the skin. Primary lesion. Which of the following is a primary lesion frequently seen in cases of severe acne? Blank. Cyst. A freckle is an example of a blank. Macule. A solid bump larger than 1 centimeter that can be easily felt is called a blank. Nodule. A blank is a raised bump that is often red due to inflammation and sore due to the pressure of swelling. Papule. A blank is a closed, abnormally developed sac that contains pus, semi-fluid or morbid matter above or below the skin which cannot be drained of fluid. Tubercle. An abnormal mass varying in size, shape and color is a tumor. Contact with poison ivy or poison oak commonly causes blank in many people. Vesicles. Wheals are not commonly caused by acne. A blank is characterized by a pile of material on the skin surface or a depression in the skin surface. Secondary skin lesion. Which of the following is an example of a secondary skin lesion? Keloid. The scab on a sore is an example of a crust. A crack that penetrates the dermis layer of the skin is a fissure. A thick scar resulting from excessive growth of fibrous tissue is a keloid. Cicatrix is another name for a scar. An open lesion on the skin or mucous membrane accompanied by pus and loss of skin depth is a ulcer. Where do comedones appear most frequently? T-zone. When the sebum of a comedo is exposed, it oxidizes, producing blackheads. A closed comedo is also known as a whitehead. Benign keratin-filled cysts that appear under the epidermis and have no visible opening are milia. Acne is a skin disorder characterized by chronic inflammation of the sebaceous glands. The chronic condition blank is characterized by redness on the cheeks and nose. Rosacea. Seborrheic dermatitis is often characterized by red, flaky skin. Telangiectasis is defined as distended or dilated surface blood vessels. A deficiency in perspiration is called anhidrosis. Foul-smelling perspiration caused by bacteria is bronchidrosis. Miliaria rubra is an inflammation of the sweat glands that is also known as prickly heat. Which of the following is a common, extremely contagious bacterial infection of the eye? Conjunctivitis. Which term is broadly used to describe any inflammatory condition of the skin? Dermatitis. Which condition often presents as a fever, blister or cold sore? Herpes simplex I. Which of these conditions is a contagious bacterial skin infection characterized by weeping lesions? Impetigo. Which skin disease is caused by the skin cells turning over faster than normal? Psoriasis. Darker than normal pigmentation that appears as dark splotches is called hyperpigmentation. A person with albinism will have silky white hair. Another name for a nevus is a birthmark. A blank is an abnormal brown or wine-colored skin discoloration with a circular or irregular shape. Stain. Which of the following is a hereditary condition that causes hypopigmented spots on the skin? Vitiligo. A callus is a blank caused by continued repeated pressure or friction on any part of the skin. Teratoma. A verruca is also known as a wart. The most common and least severe type of skin cancer is basal cell carcinoma. Squamous cell carcinoma is characterized by scalp red papules or nodules. Black or dark brown patches on the skin that may appear uneven in texture are a sign of which type of skin cancer? Malignant melanoma. What does the D on the American Cancer Society Cancer Checklist stand for? Diameter. A predisposition to acne is based on heredity and hormones. Retention hyperkeratosis is a hereditary tendency for acne-prone skin to retain dead cells in the follicle. Propionibacterium acnes are anaerobic, which means they cannot survive in the presence of oxygen. A blank product is one that has been designed and proven not to clog the follicles. Non-comedogenic. Which of the following is not an example of an intrinsic skin aging factor? Sun exposure. Which UV rays cause the majority of skin cancers? UVB rays. Which rays of the sun are known as aging rays? UV rays. To prevent premature skin aging, you should make daily use of a broad-spectrum sunscreen with an SPF of at least 15 SPF. At what time of day is UV exposure typically highest? 10 a.m. to 3 p.m. Common places for allergic contact dermatitis on a client include all of the following except soles of the feet. When irritating substances temporarily damage the epidermis, the result is irritant contact dermatitis. Which of these is not an example of an extrinsic skin aging factor? Ethnicity. Which extrinsic skin aging factor has the greatest impact on how skin ages? Sun exposure. When should you apply sunscreen? Why? At least 30 minutes before sun exposure. Which term refers to an inflammation of the skin caused by touching certain chemicals or substances? Contact dermatitis. The best way to prevent both types of occupational contact dermatitis is to y. Wear gloves when working.